Glossodynia, also known as burning mouth syndrome. It is a chronic pain condition characterized by burning sensation in the tongue or other area of the oral cavity without any visible abnormality or any medical history or dental cause. Glossodynia or burning mouth syndrome is a condition characterized by persistent burning sensation in the mouth, typically affecting the tongue, lips, gums, palate, throat, or entire mouth may be involved. Prevalence is about 2 to 5% of population and it is more common in women, especially in the postmenopausal women. Glossodynia is two types. Primary, that is, no identifiable medical or dental cause is found in the oral cavity. Secondary BMS is associated with underlying medical condition like nutritional deficiency, hormonal changes, dry mouth, or other allergies. Clinical presentation: burning sensation in the mouth, especially in the tongue region, dry mouth, altered taste or metallic taste, increased thirst. These are the common clinical presentations. Pathophysiology not fully understood. Possible mechanism involved are neuropathic pain, changes in taste sensation because of taste and pain pathway involvement, hormonal influence in the postmenopausal woman, and salivary gland dysfunction. Reduced saliva flow or changes in salivary composition may be possible pathophysiology. Diagnosis of glossodynia is diagnosis of exclusion. You have to rule out other potential causes of oral burning like infection, oral lesion, or nutritional deficiency or other allergies. Management include symptomatic treatment with topical medications, anesthetic agent, clonazepam, and systemic medication like antidepressant, anticonvulsant, gabapentin, alpha lipoic acid, and most importantly, you have to address the underlying condition. Prognosis is variable. Some patients recover spontaneously, and some patients require long term management with antidepressant medication. On conclusion, glossodynia is a complex multifactorial condition that can impact quality of life,